Okay, good morning everyone and welcome to Semel Grand Rounds. Today we have Dr. Roya Ijadi-Maghsoodi presenting on the topic of family homelessness here in Los Angeles. If you have any questions for Dr. Ijadi-Maghsoodi, please feel free to write it in the Q&A at any point during the talk or once the Q&A is started. Make sure to fill out the survey in order to claim CME credit as well. The survey should open either immediately upon closing the Zoom or you should receive an email around noon tomorrow. And with that, I will turn it over to Dr. Kataoka to introduce the morning speaker.
Good morning, everybody. Welcome to Grand Rounds. I have the pleasure of introducing Dr. Roya Ijadi-Maghsoodi, who is fast becoming a national leader in the area of prevention services for children and families experiencing homelessness. For me, there is no greater gift for a research mentor than to see our residents and fellows join our faculty and truly thrive and do the work they were meant to do. This has definitely been the case with Dr. Ijadi-Maghsoodi. She was already an accomplished scholar even before she came to UCLA, completing her medical school at the University of Iowa as an AOA member and recipient of a Community Leadership Award. She completed residency and child fellowship here at UCLA and went on to complete a health services research fellowship and master's in health policy and management at UCLA. She has also served in leadership positions, both nationally and locally in our child psychiatry professional organizations. And yes, she has received numerous grants and awards. But this past year, she was the recipient of the UCLA Humanism in Medicine Award given by our medical school. I think of all the many awards that she has received over her career, this one captures her essence as a teacher, an advocate, a researcher, and a human being. Whether she is teaching residents about the insidious effects of PTSD at the VA, or providing supervision in the asylum clinic, or doing research to improve the lives of commercially and sexually exploited children, Dr. Ijadi-Maghsoodi is constantly challenging us to see how the social context of our patients is so integral to their care, how the social determinants of health must be addressed in order to effectively do our jobs as mental health providers. Today, Dr. Ijadi-Maghsoodi will be speaking to us about the children and families experiencing homelessness and will be sharing some of her preliminary results from her K Award. We are in for a treat. Please welcome Dr. Roya Ijadi-Maghsoodi.
Thanks so much, Cheryl. Hi, everyone. Thanks for being with us today. I'm really excited to talk to you about this topic, and I'll come together virtually in this webinar. So I'm going to be talking about family homelessness in LA County today. Just some of my disclosures of potential conflicts of interest. The study I'm going to talk about today is funded by an ACAP NIDA K-12 award, and then some other funding sources. And really, I want to talk with you about the mental health and the structural challenges families experiencing homelessness face in LA County based on research we've been doing for the last several years, and then discuss a family resilience intervention that we've adapted for families experiencing homelessness, and then identify strategies to support families right now and to support families experiencing homelessness. And hopefully have some time for questions and virtual dialogue with you all. So I wanted to share my own personal narrative timeline. Dr. Held asked us all to share our own kind of narrative into this work. And so, I've always been interested in working with homelessness. In medical school, I worked with patients experiencing homelessness, but it wasn't until I was at UCLA, I had the opportunity to do a rotation at St. Joseph Center in Venice. And that was when I was a third-year resident working with people experiencing homelessness who are getting housed, who are receiving housing. And it really opened my eyes to a lot of the barriers people were facing in Los Angeles, and also really the histories people I was working with had kind of growing up and leading to their homelessness. Then after that, I worked in Pacoima with children and families. And at this time, at Hathaway Sycamores. At this time, I was seeing kids, I was treating them for behavioral problems, emotional problems. And there were some cases I were working with the family and the kids and treating ADHD and finding things not getting better. And I just realized that I wasn't screening families who are homeless. I realized some of the families that I was working with were living doubled up with other families, that they were facing impossible situations. And I'm trying to treat the mental health problem without kind of understanding the structural stressors going on. And so that really made me interested in how do we address homelessness? What are the interventions that work for kids and families? How do we address this in a family approach? And so after that, I did a health services research fellowship at the VA, and I worked with veteran parents experiencing homelessness, doing a qualitative study. And we found that parents experience mental health stressors, substance use challenges. And following that, I've highlighted a picture of Dr. Feller, one of the residents. We did a study working with families who had received housing and looking at community integration. How did families integrate into the community after experiencing homelessness and receiving housing? Dr. Feller helped me a lot with this project. And we found that families still face challenges and that there were new challenges, and oftentimes support would come away once families were housed. And I was lucky in 2016 to receive this NIDA ACAP Career Development Award to really focus the last several years on families experiencing homelessness in LA County, which I'm going to share with you today. So that's my own narrative timeline so far. And really the basic principle really underlying my beliefs and my work is that housing is a human right. And this was in the Universal Declaration of Human Rights adopted by the UN in 1948. I think many of you know this, but it says everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood. And so really, this understanding that housing is a human right. People need housing to survive. And then what I found throughout this time is that housing really is a privilege, not a right in LA County. And I think this is something we see a lot. We see these images when we're out, if we go out now during COVID. And I just wanted to share a quote. I'm going to share quotes from families I've interviewed throughout my qualitative research with this study that really shows that it doesn't take much to fall into homelessness in the city and how difficult it can be. So this mother said, being homeless is really hard. It's like you got to keep a smile on your face. You got to pretend everything is okay, even though it's not. And it's like to instill in your kids, if you work and you try hard, you can accomplish what you want to. But life can still throw lemons at you, and you got to be ready for them. So really, no matter how hard you work, things happen, and people can fall into homelessness. Just to give a quick overview of the prevalence of homelessness for you all, based on these national point-in-time counts and the local point-in-time count in LA County. And for anyone who's done this, I know the count is canceled this year, but it's quite an experience to go out and help count the people who are experiencing homelessness. But in the United States, the 2019 point-in-time count found that 171,670 people were in homeless families. So this is about 30% of the homeless population, most sheltered. In LA County, the 2020 continuum of care point-in-time count showed that 12,416 people were in homeless families, also mostly sheltered. And thinking more about this, there's 58,179 housing vouchers in use in LA, and as of January 2019, there are 45,384 families on the waiting list. So families waiting for housing voucher to get permanent housing, waiting for years on this list. But these numbers don't tell the whole story of family homelessness. So like I said earlier, if you've done the point-in-time count, you go out and you count people experiencing homelessness. You count people in their cars, you count people in a tent on the street. So this is actually a narrow definition of homelessness. So the McKinney-Vento Act establishes a definition of homeless youth or children that US public schools use. And through this definition, youth and children count as homeless if they are doubled up or couch surfing. So if they're living with other families, if they're living in motels, hotels, or camping. And this is a wider definition that schools use to count homelessness and that collect the data of students who are experiencing homelessness. So based on this count, this wider definition, really the numbers are striking, and child and family homelessness is growing in the US. And this is quite different than the earlier count I showed you, with 171,670 homeless people in homeless families. So based on this federal public school data, there's 1.5 million students experiencing homelessness, and this has been growing over the years. And here in Los Angeles, in our LAUSD, our school district, there's 19,000 students experiencing homelessness. So pretty significant issue. And what the research shows is that most youth are living doubled up. So they're living with other families. So 74% of these students who are considered homeless are living in a doubled up capacity. So a lot less unsheltered, 12% in transitional housing. So numbers that we're not capturing out on the street when we're counting. And this is concerning. Not only are these youth considered homeless, but they're, overcrowding, multiple moves, housing instabilities, really associated with healthcare and mental health costs. So decreased healthcare access, child health problems, poor academic performance when people are moving around frequently, and mental health problems. So this is a significant issue that causes adverse outcomes. And I wanted to share an example from our study of how one mother became homeless. And these stories are all different. So one story does not represent all, but it just gives a little bit of a glimpse of what can happen for families and what happened to this family. So this is a mother we interviewed, and she said, when I first had to move, I had to stay with a friend. Her landlord was like, well, they're not on your lease, so you have to put them out. I got a place, and the place wasn't right for my baby. She came up with lead poisoning. So the doctor was like, well, I have to call the people out on you. They were like, well, you have a decision. Are you going to stay here and get your kids taken away, or are we taking you to a shelter? My decision was I cannot get my kids taken away. And I was like, hey, just take us to the shelter. We went to the shelter, and there was a lot of stuff going on. So after maybe 2-3 weeks we were there, somebody got killed downstairs. So I'm like, okay, we're going to go to a room. So I cleaned out my whole savings and went to a room, a motel. And, you can just see in this path, all these factors going on, being doubled up with another family, having to leave because you're not on the lease, having concern about lead poisoning and protective services being called, and eventually just concern for the family and using all the money to go to a safe place. So just these different factors combining, how easy it is to kind of fall into homelessness. And building on this, so some of the reasons for family homelessness, and there's different reasons, but some of the things that we see, and I think a lot of about too, is the affordable housing crisis. So in Los Angeles, we have a significant affordable housing crisis. So there's only 36 affordable and available rental homes for every 100 extremely low income renter households. So in every state, every major metropolitan area, we're seeing this housing crisis where people just cannot afford housing. There's lack of housing assistance. So only 25% of very low income families receive housing assistance. There's evictions, something that there's a lot of concern about right now with COVID and concern about evictions. Families who have children face higher eviction risk. Kids are noisy. There's complaints about noise. There's lack of daycare. There's racial disparities in evictions, which we'll go over in the next slide as well. There's wages that are not keeping up with the cost of housing. So unlivable wages. From a couple of years ago, there was some data that a renter who was earning minimum wage would have to work 79 hours per week just to afford a 1-bedroom apartment in LA. There's racist housing policies. Landlords often refuse to accept Section 8 housing vouchers. And a recent study showed that 76% of listings refuse to accept vouchers in LA. There has been changes, California law, to address some of this, but we still hear this, that people don't accept housing vouchers. It's difficult to even use a voucher to find housing, and that this is worse for minorities, for families who are Black. Racial discrimination blocks Black people from securing rentals of their choice more often than other racial groups, based on research out of Boston. And then domestic and family violence. So 80% of women with children experiencing homelessness experience DV. This has been a rising concern during COVID and about safety of families and domestic violence as well. And just to touch on the structural racism component, because there is an overrepresentation of Black families experiencing homelessness. And this is due to structural racism, discrimination that affect employment, that affect housing. So one thing is that Black families are more likely to rent their homes and are hardest hit by evictions. And this little bar chart shows kind of the Black-white ownership gap, and that how it was lower in 1960s than now, than 2018. And Black households are more than twice as likely to face evictions. And also, housing policies tend to favor homeowners. So this all creates structural racism where these households are more likely to face eviction, and something that's a concern right now as well. So after presenting all this, you may wonder, why is this relevant to you? This is a psychiatry grand rounds, a mental health audience. But really, while this is happening, while policymakers argue over housing policy or over employment protections or eviction, basically children and youth they're growing up homeless, and they're perpetuating this cycle of homelessness. And this is where, as mental health clinicians, mental health researchers, we can come in and address the mental health needs of the families now, especially trying to prevent mental health issues in kids growing up in these families, while everyone else and us trying to address the structural determinants as well. And so children experiencing homelessness are at risk for adverse outcomes. So substance use disorders, mental health problems, including in adulthood, poor health, including in adulthood, academic failures, and homelessness later on. So this isn't just a child mental health provider issue. This is really an issue facing everyone working with kids and adults as well. So in addition to these policy level interventions, these advocacy interventions, we also need family level interventions to address the needs of families now. And children exist within a family system. So we know that supportive and responsive parenting is the strongest protective factor for children exposed to adversity. So children like the families I've described so far. But there really is a lack of evidence-based programs specifically for families experiencing homelessness, and prevention programs for kids growing up in these families. So that leads to my current research, which I'm going to go over with you. And this is our study that we've been working on for the last several years, focused on helping families who are experiencing homelessness in Los Angeles. And first, we tried to understand the needs of families experiencing homelessness, the mental health needs, the structural needs, and then use these findings to adapt a family resilience intervention. So I'm going to share with you some of our findings from the program, and then also touch a little bit on our intervention as well. So the three aims of our study. So our first aim was doing qualitative interviews with families experiencing homelessness and parental substance use disorders and providers throughout greater Los Angeles. Second was to adapt this family resilience program called Focus, that many of you may know about, for families experiencing homelessness and parental substance use disorders, and then pilot test this adapted intervention among families in LA County. So our first aim of the study, we conducted interviews with families and providers. So we did 56 total interviews. We interviewed parents with a history of homelessness within the past 2 years, and a history of alcohol or substance use disorders within 3 years. And we focus on this population because this is a population where kids are at significant risk for mental health and substance use problems as well, a very high risk population that often does not receive care. We interviewed youth in these families between the ages of 10 to 18, so that the kids of these parents. So we did dyadic interviews, and we interviewed homeless service providers throughout Los Angeles. And we initially were going to interview less homeless service providers, but we had so much great information and so many people willing to share their stories and their work that we interviewed 25. We did brief demographic questionnaires, semi-structured interviews. We recorded them, we transcribed them, and we analyzed using content analysis. And just a brief kind of look at our interview guide, we asked about shared experiences, so family experiences with stress, needs, and substance use. We asked about resilience skills for families, so family processes, family stressors. We asked about family coping, including substance use and strengths. And we talked to families and providers about experiences and barriers with services and recommendations for an intervention. And just a brief look at the family demographics. So the median length of the current homelessness episode was 12 months for the families we interviewed. 40% of the families we interviewed were child welfare involved. And we weren't recruiting for this, but we are analyzing kind of findings from that separately, which has been really interesting as well. And parents had about 3.4 children in their custody. And then for the race ethnicity, 38% Black, not Latino, 38% Caucasian, 12% Latino, 12% 2+ races, not Latino for the parents, and then similar for kids. So I wanted to touch on the family stressors that families who are experiencing homelessness underwent. And this could be a long talk, but I'm just going to touch on some of the themes that came out of our interviews, talking to the parents, the providers, and the kids. So the first major theme is that trauma is pervasive among parents. So parents that we interviewed experienced extraordinary trauma in their lifetimes. And I say parents, we mostly interviewed mothers in our study. And then the second theme was homelessness as a trauma for youth. So youth experienced trauma as well. And this was related to things such as family separation from child welfare involvement, trauma of the homeless environment, which I'll talk about a little bit more too. We found that communication breakdown inhibits families from moving forward. So families faced barriers to communicating, and this was related to feelings of guilt, regret, barriers communicating about past trauma, family separation, related to the homeless experience, and related to parent substance use that came up. And this theme that the only goal that matters is housing for everyone. So really, this was that everyone's goal was focused on finding housing, which makes sense, but the youth goals were really focused on helping the parents find housing. And this theme of nevertheless, families are resilient. So I don't want to only focus on deficits. These families are very resilient, very strong. The mothers were resourceful, relied on other mothers. Mothers were, and parents in general, were committed to their children, and children found ways to cope. Children were adaptive, and they were resilient. So I wanted to share the first theme, and this theme of trauma is pervasive among parents. And this parent said, quote, "My first son passed away. I was very young. I was 15. He passed away at 6 months, and I never got help for that. I never got therapy. I didn't process it. I was a mess. That's when I started smoking weed. And then after that, it was the meth for about a year." And this is just a similar story that we heard from parents, a significant trauma early on or during their lifetime that they had never received treatment for or had processed. And this mother had experienced significant trauma. She became homeless after leaving her husband, and despite working, she couldn't afford rent, which is a story we hear a lot in LA. And she moved into a homeless shelter in LA before moving into transitional housing, where we interviewed her. And then this theme of homelessness as a trauma for youth. So we interviewed her child too. And it was striking to us how much trauma the youth underwent. And these ranged from kind of witnessing traumatic events, trauma of the environment, and that this was often different than what parents talked about. So just as an example, this child said, just seeing homeless people in front of the shelter, they're breaking the glass. One man broke glass with his head, a lot of drugs on the sidewalk. It was stressful in the area around our facility because you'd have to worry about getting run over, getting hit by some crazy dude coming up at you and maybe knocking you out. And so this, children brought up stressors of the housing environment that parents didn't necessarily bring up. So this parent did not bring this up, but this child advocated for shelters to be safer. And I think it's just important for us to remember how frightening experiences can be for children and the trauma that kids can undergo as well. And then this theme of communication breakdown inhibiting families from moving forward. So we found significant barriers to communication, like I said. This was an issue brought up by parents, by youth, providers. So this is one example from a mom. A mom said, quote, "You talk to the kids. You ask your kids for forgiveness. You let them know, when I was going through this, this is what it was. This is what it is, and now I'm a changed person, or I'm here because I want to change. I feel like a lot of mothers should sit down and talk to their kids and just be real instead of running, because your kids know what they did." So this mom actually talked about communicating with her kids. She had her children in foster care, and they'd gone through experiences that she sat down and she spoke with them about, but she also brought up how other parents in the facility felt guilt and felt shame and regret over the past, and that this stopped them from being able to communicate with their children. And this is something the providers brought up a lot too during our interviews. And I also wanted to highlight this theme about the only goal that matters is housing for everyone. So of course, housing is paramount for people experiencing homelessness, for families. And this goal was so important. It was families needed to have housing before they could attend to other needs. But it was concerning too that this goal was often forefront for children as well. And so having goals, setting goals is protective for children. And this child said, quote, "She has to push herself to get a job. We children have to help her get there to reach the goal to not get homeless again." And so it's concerning when the goal of the child is focused on ending homelessness, helping the parent, and not their own goals as well. And so this can be a lot for kids to take on. And then despite these stressors, the families did demonstrate evidence of resilience. So parents doing whatever it took to keep on moving with their kids, keep moving forward. Parents where kids had been separated from them. And we asked the youth, we asked them what they would recommend to other kids going through this experience for a younger child. And kids brought up different coping skills they used, recommendations. This was a teenager who was living in transitional housing with her mother and younger siblings. And she said, "Keep your head up and just always stay positive. If you have problems that you're going through, just know that it's going to get better and that everything happens for a reason. It'll get better. You'll get the help that you need. You'll end up being settled sooner or later. You're not going to stay in one place forever. You're just going to keep on moving." And so really this kind of wisdom and strength of the kids as well. And I wanted to touch on the structural stressors of families experiencing homelessness. This could also be another talk, but we can't only focus on the family processes and the mental health needs, just also everything going on in the environment around these families. And what we found is that families are in a pernicious housing environment. So families, we interviewed families living in transitional housing. Many of these families were really concerned about the next step. What happens when they leave transitional housing? Out of all the families we interviewed, only one family had a housing voucher. So families talked about needing increased access to affordable permanent housing. They need housing vouchers. They're on waiting lists for years. When families were looking for housing, it was in unsafe, low opportunity areas where parents felt unsafe having their kids live there. And then families encountered racist and structural barriers. Parents talked about discrimination when they're trying to find housing, discrimination from landlords. And then also this theme of families needing more support. So mental health support, also housing support. And really families not having enough time in transitional housing. This came up a lot with providers who talked about families needing longer time to kind of get employment, to work on finding housing, to work on mental health needs, and not having enough time there. For some families, rapid rehousing was not enough, and we'll go into some of that a little bit further. Families need trauma-informed services. Families discussed, given all of their trauma, having providers understand this and having facilities understand the trauma the families have been through. And then families desiring increased mental health services for their children. So wanting family therapy, wanting kids to have mental health addressed as well. So this theme of families needing more support. So one thing that came up among our families was this concern about needing long-term housing options after families left housing, after they left their transitional housing. So many families were out looking for market rate apartments without the ability to afford this or to sustain this. Some were offered rapid rehousing. However, although this worked for some families, other families and providers brought up that this wasn't sustainable for some families. There wasn't enough support long-term for some. This mother explained this. So she said, the case manager, found me an apartment the same day I got accepted here, which is a transitional housing facility. But 6 months down the road, I would have to pay the full rent, which would have been $1,250. I didn't know what my income was going to be with all the kids, so I didn't want to set myself up for $1,250 rent. 6 months down the road would have been January, and I had my baby in December. So she was having a baby, an infant, and knowing that she would have to kind of pay full rent for a place after after leaving, not being able to do that, not having the income source to do that. So really concerns about what families were going to do, how were they going to continue to survive without help for housing. So based on all these interviews, based on all of our findings, we used all the findings to adapt this family resilience intervention for families experiencing homelessness called FOCUS, developed by Dr. Lester and others at UCLA. And this intervention was designed for military families, so families with traumatic stress in the military, and found to improve family functioning and youth mental health symptoms. And we chose to adapt this for families experiencing homelessness and parental substance use, given the high trauma prevalence in our families. And basically, just briefly, the intervention focuses on developing a shared experience among family members with a narrative timeline, focusing on these 5 resilience skills: emotion regulation, problem solving, communication, goal setting, and managing reminders, which leads to family resilience and coping. So we used our interviews. We also did work groups with parents to adapt these core components of the intervention. And this is a busy slide, so I won't go into everything, but we talked about communication breakdown in the family. So families had difficulty speaking about past events. They felt guilt and shame. So we added earlier sessions to the intervention, really focused on communication and active listening and communicating with your child, even on things such as communicating with your child about school and in the transitional housing setting, things that were coming up. And then goal setting. So this primary goal of housing, that's important. And in the intervention, we focus on family goals. So adding kind of a case management advocacy goal for the whole family, but also adding this skill of setting youth goals. So helping kids develop goals that were separate from their immediate housing goal or the parent employment goal, because this is protective for kids. And then some other components that we adapted as well. And given the significant trauma that families endured, including the fact that many families, the trauma wasn't over, they were concerned about falling back into homelessness in the future, or they, had ongoing homelessness and constant reminders of this. One of our activities include this shared identity project. So helping families focus really kind of on the immediate situations and on the future, instead of going through all kind of the traumatic events in the past. And this is just a case example I made up, kind of based on work with the families of an example. So this family worked on where we have been as a family. So living in shelters and motels, having a period of separation from a younger child due to CPS, older siblings living separately, hard to talk about the past or arguing, where we are now as a family. So child has his own room, they're looking for an apartment, communication has improved, they're able to spend more time together as a family, and then where we are going. So an apartment of our own, the mother working a meaningful job, son graduating, and rebuilding relationships with other family members. So just kind of an example of this for families. So where we are now, we adapted this intervention, and we're in our 3rd aim of pilot testing and doing a pilot trial. So like probably many of you, we started enrolling families early March. And so we had to shut everything down, the 2nd week in March when everything shut down from COVID. And so that caused us to kind of reevaluate and have to rapidly adapt our intervention for telehealth, knowing that we couldn't go into facilities. We were planning to do the intervention with families and in their facilities. And so we're currently recruiting families who have been homeless within the past 2 years and families living with a youth 8 to 17. And we're recruiting from 5 transitional housing facilities, 2 permanent supportive housing facilities, clinic, 4 different agencies, the VA and UCLA. And we're recruiting families, screening them, giving them a baseline survey and randomizing them to the intervention or to treatment as usual, and then doing 3-month and 6-month follow-up surveys. And we adapted the intervention to be delivered through telehealth remotely because of COVID-19. And it's 8 sessions or 8 modules delivered by me or other facilitators on the team. And I wanted to share some of the challenges during COVID-19. So just based on our what we've been finding in our study and kind of recruitment and doing the intervention, I mean, the first thing really is facilities dealing with COVID-19. So having to deal with concern about people getting COVID and providers getting COVID and that stress. Families are under great economic uncertainty, trying to work right now, given unemployment rates that we've seen since the spring. So families are really stressed. There's families without Wi-Fi, data, cell reception. There's a definite digital divide when we're trying to do an intervention that's telehealth, and we're trying to give services that are telehealth. Families are leaving transitional housing during this program. So even though, eviction moratoriums are in place, people are still moving around in transitional housing and going to different facilities or being asked to leave. So having to kind of find housing during a pandemic, so that's stress. And then, like many of you, families just juggling children being home from school, competing demands on their time, trying to do all these things. And so some of our intervention adaptations, and I would love to do this live with everyone and hear other people's thoughts on ways to work on these kinds of studies during COVID. We've done Zoom drop-in sessions, so hosting sessions for families to come to. We relied a lot on case manager referrals from facilities, which does put a demand on their time as well. We've bought iPads with Wi-Fi and data for families that do not have access, that we send to families. And then we're also doing intervention sessions, meeting families where they are at. We've done sessions on the way to COVID testing sites for families. So really understanding how stressful this situation is for people right now and how can we help support as well. And, along with the current challenges we're seeing, there's research coming out, there's predictions coming out that really COVID is going to cause an increase rate, a rise in homelessness, an increased risk in homelessness. So this report from the Economic Roundtable that came out in January predicted that there would be a loss of jobs and employment income, causing the number of workers who are homeless to increase. And so this data, they use data from the 2008 recession to estimate a linkage between job loss and homelessness to predict the response after the pandemic from pandemic-driven homelessness. And so it's predicted that homelessness among working age adults would peak in 2023 with 52,000 additional adults homeless in LA County. These risks were highest for workers who are Black, Latinx, women, and young adults. And then really that families are going to have greater trouble paying for housing post-COVID. So we know that families have struggled paying for housing pre-COVID. So this risk of not being able to pay rent or mortgages and risk of eviction. So really this concern of a rise in homelessness and for families. And solutions to this that have been put forth are fully fund rent subsidies for low-income families, increased subsidies for building affordable housing, increase, the abilities of families to stay housed and to work. And just to give some takeaways, so, I presented our research, some of the findings, but what can you do on a patient level? So for those of you who are clinicians working with patients who are families or youth experiencing homelessness, what can you do? And so I think, going back to the beginning of the presentation, where we found this really high prevalence of students experiencing homelessness, that we this high prevalence of family homelessness. And what I learned early on is that you really have to ask about families' housing situation and ability to make rent. So we really have to ask and find out if people are experiencing homelessness. So things such as, have you ever lived without a place of your own? Asking about ability to make rent. And then we can also just recognize this massive structural barriers to finding housing. So how, even if we're treating the mental health components for families or parents, how stressful it is trying to find housing in the system and how overwhelming it can be for families and how this can just really supersede everything. And then understand the role of trauma. So we talked a lot about trauma among parents, among kids. So really using a trauma-informed approach to working with families and also addressing the mental health needs of parents, addressing trauma of parents. And then what we can do at an advocacy level, because we've also talked about a lot of structural stressors that are going on. So really advocating for increased permanent housing, increased access to housing vouchers, increased access to housing in safe, high opportunity neighborhoods that families want to live in, instead of, promoting housing in neighborhoods. As mental health providers, mental health clinicians, speaking out about the mental health effects and trauma associated with family homelessness, the mental health effects of overcrowding or living doubled up, these cascading effects that can affect the entire lifetime. And then right now, during this pandemic, when there's concerns about people's ability to stay housed, or referring to legal services if there's any concern about impending homelessness or evictions, and really taking advantage of all these services people are trying to work on right now. And this is a website where if you're working with a family that there's concern about paying rent, concern about eviction, you can go in there and select one of the options and connect them to a legal aid attorney. And then the next steps for our study, doing a larger trial. So this turned into, it was an adaptation of an intervention for families experiencing homelessness that was rapidly adapted during COVID to address stressors of COVID and deliver in telehealth. So it's a pilot trial, but really doing a larger trial. We also want to address student and family homelessness within schools. So going back to the research I presented on students, how do we address homelessness within schools, given that we're collecting data from them, and what can we do to kind of stabilize families there? And that we will be also partnering with LAUSD to administer a social determinants of health screener, which will help give more information about the stressors kids are going through in schools or experiencing homelessness and other structural stressors. So I also wanted to thank everyone that I've worked with. I've had amazing mentors, collaborators, community partners, Dr. Kataoka, who introduced me earlier, and all these other amazing mentors, our project manager on our research, and then all the students. We've had really great trainees and students working on the project, bringing amazing insights and inspiration too on everything. So, all right, so there's my email. If anyone wants to contact me, I'm happy to talk more and answer questions through email. So thank you.
Great. Thank you so much, Dr. Ijadi-Maghsoodi. Just your rich descriptions of these families and children really breathe life into who these families are and their struggles, their multiple layers of struggle. We have a number of questions kind of pertaining to like, what next? What can we do? And I know that towards the end you addressed some of that, but maybe you could dig in a little bit more. Our first question was, do you have suggestions about how we as psychiatrists can help our patients specifically who are experiencing homelessness navigate housing resources? So you gave that great website, but what else can psychiatrists do in their office?
Mm-hmm. Yeah, so yeah, this is a good question. I mean, I think the hardest thing is we're trained as psychiatrists. We're not necessarily trained in these other, navigating kind of resources, but there's a lot of resources out there. So I did give that website for the Stay Housed LA, but also, I mean, there's the website 411, that, other websites to look at. The first question is just to ask. So I think find out what's going on. So, treat homelessness as a problem on your problem list and in your assessment and your plan. And how are you going to address this? And so first ask, find out what's going on, and then refer. I think maybe because I'm in a family of lawyers, I keep saying to reach out to legal aid attorneys, but there really are a lot that legal aid attorneys can do to stabilize housing. And so I think that's one option. And then I think also I actually have a list of resources I'm happy to send around, but also try to access any kind of resources in Los Angeles County, try and know the resources available to refer to. But just asking and just being aware, that goes a long way, because I think a lot of people aren't going to bring this up with you as a provider if they don't feel comfortable talking to you about it and that you're able to help.
Yeah. Yeah, and then others asked questions about even their environment. So not even their, work and the patients they're with, but even where they live. And so someone asked, outside our condo development, there are tents and lots of campers parked. My neighbors are calling police and councilmen to just get rid of them, remove them. But I declined, and instead I brought sandwiches. One tent I noticed had a mom, a dad, and a child.
Mm-hmm.
What else can us as individuals do?
Yeah. Oh man, that's really hard. And thank you for bringing them sandwiches. And I mean, I think you're doing the right thing. So supporting them, helping connect to resources. So looking at resources available kind of in the community, and trying to connect to that. I mean, reaching out to your council members against this, against getting them removed, but on what they do to get them immediately connected to housing. There are rapid resources in Los Angeles right now. So trying to get access to that, to get people into safe housing right now. So.
Yeah. And another person wants to know, you've also talked about, different policies, how, at kind of the policy level, both locally and nationally, that are going on. But how does an individual psychiatrist, get involved with advocating? If you want to get involved, how would you go about doing that?
Yeah. So I think, so there's a lot of organizations working on these things. So you can get involved with local, so community organizations, to offer your services. You can speak out, you can give public comment, you can go to these meetings that are happening, that are people are trying to, advocate for changes in the community. You can go and speak from a psychiatrist perspective on the mental health concerns. So I think, organization, on a local organizational level with these community organizations that are working really hard, and then nationally trying to get involved with advocacy organizations, kind of homelessness organizations. But I think just speaking out and using your voice is really important right now in the community.
Yeah. We also have a question saying, Dr. Ijadi-Maghsoodi, thank you so much for sharing this important topic and work with us. Could you describe in more detail the school interventions you and your team are considering? How can schools help students struggle with homelessness?
Yeah, so I think, Dr. Kadoka might be able to respond with that too, because she has a long history of working with the schools. I mean, I think the thing that's great about schools is that's where kids are, that's where students are. So we have access to them, and they're, so I think, otherwise, I don't know how much we're seeing these families, or we're seeing students that are homeless otherwise. So, and just helping, so can the schools be a hub to connect them? They are, to connect them to resources, and how do we support them, the mental health needs of the kids in the schools by doing a school intervention, and then also kind of helping bridge this link to housing with the schools as well. But I mean, schools are a hub for students where there's mental health, there's social resources. So how do we really build on that to address their needs, especially after COVID, after we see kids come back and these significant issues arise? Yeah.
Yes. Another person wants to know which US cities serve as models for effectively and humanely addressing homelessness.
That's a good question.
Are there?
Yeah, I think, I would need more time to answer this question. I mean, there are cities that have eliminated, that are close to eliminating homelessness, which probably have less people who are homeless. I mean, so, I think I'll have to think a little bit more about good models, but there are things happening. I mean, there's things happening during the pandemic that could have been kind of amplified. There was, for the first time ever, people were just going to rapidly house people in hotels, right? And motels. And there's so much empty hotels right now. I mean, in Los Angeles and motel rooms. I mean, so little efforts that have happened, I think we need to use that ourselves as a model and just amplify the efforts. So, housing people more rapidly, getting them quicker into permanent housing, using what's the structures that are available right now. So, and then even all the work on the eviction moratoriums, like what that's happening now, that, this should be ongoing. We should be trying to stabilize evictions past the pandemic, knowing that this is such an issue for homelessness. So I think just kind of thinking broadly right now on things people are trying to do and just making it bigger and as well. So
we have another question asking about the intervention that you're doing. How do you intervene on substance misuse amongst homeless families?
Yeah, and our intervention is really preventive. So it's a preventive intervention for kids, and it's for the whole family, but it's to help kind of prevent mental health and substance use in the kids. And so really, we're not addressing the substance use in parents, except that we are helping them talk to their kids about risky substance use and substance use prevention. So we're really more just doing these resilient skills to help strengthen the family, not necessarily intervening on the substance use itself, but hoping that these skills can prevent problems in the kids and then also help kind of stabilize the family as well.
Mm-hmm.
Yeah.
We have another question asking, how can psychologists and psychiatrists work to address the systemic racism that clearly contributes to a lot of the issues your study identified, especially when many mental health services offered here at UCLA, for instance, are not covered by Medi-Cal?
Mm-hmm. Yeah, I mean, that's a really good point. So I'm not in charge of UCLA, but I think, so some of the things I brought up, kind of these upstream factors we talked about earlier, like the housing issues, that all of those we can work on. We can, addressing, so kind of recognizing the housing discrimination that's happening. That's something that we can start working on kind of upstream. In terms of increasing, the question was also about increasing mental health resources for these families. Is that right? So, I think, advocating to increase mental health services, for Medi-Cal, we can do all that. So, as a psychologist and a psychiatrist, I think just really understanding the mental health needs and the trauma needs of these families too, and of these kids, and trying to address this on a systems level, trauma-informed level, within the shelters, within the facilities as well.
Mm-hmm.
So
yeah, and the question also kind of asked about addressing systemic racism, which I know that you've also been involved with at UCLA and elsewhere.
Yeah, that's a great question. So I think in terms of homelessness, though, I think addressing the systemic racism in housing and who becomes homeless, and what services are, who's getting involved in child protective services. So really addressing all these factors too. But it is a systemic racism component related to homelessness and what's happening with who's falling into homelessness. And so really having to think about that and address that.
Yeah. And maybe this could be our last question, kind of a big wrap-up question.
Okay.
What do you see as the major barrier to, quote, solving homelessness? Money, politics, public support for interventions, lack of integrated mental health care to support successful housing initiatives. Optimistically or pessimistically, which of these seems most or least likely to change?
So I think money and housing, we need to increase housing to solve homelessness. So I think we need to increase affordable housing in communities. Communities need, and safe communities for families, increase access to housing. I think it's a housing issue for homeless, especially for families. They need to be housed. So money and housing, and public support. There is growing, even from today, we heard some of the comments that people publicly trying to support people who are unhoused in their neighborhood. So, increasing that public support, but just having the housing, affordable housing for people to live. Yeah.
Okay, let me see. There's a few more questions that are still coming in.
And I think there is, Adam shared a list of so some people are sharing in the questions, community resources that are helpful, but I don't know. I know everyone can't see what I'm seeing, what we're seeing. So maybe we can even, if people are interested, we can email out resources, we can email out links.
Yeah, a number of people wanted the resources. I assumed that there was some way that Jonathan could get that out to all that attended today. because you had some great resources in your slide deck as well. And I think people want those links.
Yeah. Oops. Yeah, here's the link for the staying housed. But I can also, I'm happy to email out like a collection of resources and kind of ways that you can connect to organizations, or that numbers you can call to advocate for families.
Great. Well, maybe we will end there. Thank you so much, Dr. Ijadi-Maghsoodi, for such a stimulating and inspiring talk today. I think you really have people thinking and wanting to get out there and advocate and to really improve all the care that we are providing as mental health professionals. So thank you very much. And thank you everybody for attending, all your great questions, and we'll see you next week.
Thank you, everyone. Appreciate it.